So if you break your arm, the medical treatment is honestly incredibly straightforward. I mean, you go in, you get an x-ray, and you literally see a jagged white line on a black screen.
Right, it's completely binary. The doctor points to it, hands you a cast, and that's that.
Exactly. It's visible and it's comforting because you know exactly what is wrong and, how to fix it. But if a 16-year-old is struggling with severe depression or anxiety, that x-ray machine just doesn't exist.
No, it doesn't. And the standard prescriptions we have, usually talk therapy and, an amber bottle of pills, they just fail at an alarmingly high rate.
Yeah, we are looking at a diagnostic and treatment landscape for youth mental health that is, frankly, frustratingly murky.
It really is. It's entirely trial and error in so many cases. And for a young person in crisis, I mean, trial and error is just a terrifying process.
Which brings us to the mission of this custom deep dive, crafted specifically for you listening today. We are exploring a massive intersection of physical and mental health.
Right, to answer a surprisingly complex question, which is, what is the absolute best type of exercise to treat and prevent anxiety and depression in young people?
Yes, and to figure that out, we are unpacking a massive 2023 systematic review and network meta-analysis. This was published in Frontiers in Psychiatry.
And we should note, this isn't some isolated small sample study.
Yeah.
This actually covers 58 individual studies and nearly 5,000 participants.
All between the ages of 15 and 24. And because prescribing physical exertion obviously carries its own physical risks, we're pairing that with an epidemiological breakdown.
Yeah, a breakdown of injury rates across various strength sports from the database Evidence Strong.
Right. So the scale of that Frontiers study gives us an incredibly robust foundation.
It really does. I mean, a network meta-analysis doesn't just look at, one treatment against a placebo. It takes multiple different treatments and mathematically pits them against each other.
Like a tournament bracket.
Exactly, like a tournament bracket to see which one actually comes out on top.
And I gotta say, the winner of that tournament is gonna challenge a lot of long-held assumptions. The ultimate physical prescription for mental health isn't running.
Right.
And it isn't yoga. The most effective treatment actually isn't in a pharmacy at all. It's on a squat rack.
Which is wild to think about.
It really is. But before we get to the solution, we kind of need to understand the severity of the problem. The Frontier study focuses exclusively on youths aged 15 to 24.
Right.
And that is a very specific, highly volatile decade of life.
Oh, absolutely. It is arguably the most critical transition period a human goes through. I mean, think about what's actually happening between 15 and 24.
A lot of chaos.
Tons of chaos. Biologically, the brain is still aggressively remodeling itself, specifically the prefrontal cortex.
Which is the part that handles decision-making and emotional regulation, right?
Exactly. And then socially, you are transitioning from the rigid, highly structured hierarchy of high school to the total unstructured chaos of early adulthood.
Like going to college or entering the workforce.
Right. And because of these massive internal and external fluxes, individuals in this age bracket are at a uniquely high risk for developing clinical depression.
It's essentially a pressure cooker. And if you develop depression in that window and it just goes untreated, the data suggests it creates neural pathways that make you, far more susceptible to chronic depression as an adult.
Which means the stakes for getting the treatment right early on are incredibly high.
But let's look at what usually happens. So a 19-year-old goes to the doctor for depression, and they are typically met with basically two options, psychotherapy or antidepressants.
Yeah, that's standard care.
So why are we even looking for an alternative?
Well, because the real-world application of those conventional treatments is basically failing a massive portion of the population.
Right.
I mean, psychotherapy is highly effective for some people, but it requires serious resources. It's expensive. You have to actually find a practitioner you connect with, which takes time.
And unfortunately, there's still a huge social stigma, especially for teenagers, that prevents a lot of young people from even, making that first appointment.
Exactly. So then you have the pharmacological route, the antidepressants, and the source material highlights compliance issues here that are genuinely staggering.
Yeah, I was shocked by this.
The data shows that anywhere from 20% to 59% of patients quit their antidepressant medication within the first 3 weeks of starting.
Wait. So up to 60% of people are throwing in the towel before they even hit the 1-month mark?
Yep.
Why is the attrition rate that catastrophic?
It really comes down to the timeline of the neurochemistry. When you start a common antidepressant, like an SSRI, the adverse side effects often hit on day one.
So we're talking nausea, insomnia, emotional blunting, lethargy.
Exactly. You get all of that immediately. But the therapeutic benefits, the actual relief from the depression, well, that can take 4 to 6 weeks to materialize.
Oh, wow.
Yeah, so you're asking a teenager who is already profoundly unmotivated and suffering to endure a month of feeling physically worse before they feel mentally better.
It's like prescribing a life jacket to a drowning person, but the life jacket is covered in thorns, and you tell them, hey, it won't actually inflate for another month.
That is a perfect analogy. And it's no wonder they take it off.
Right. And this massive gap in effective, tolerable treatment is exactly why researchers started looking at exercise.
And thankfully, the meta-analysis confirms that yes, across the board, exercise significantly outperforms usual care.
And by usual care, we mean wait lists or just a placebo.
Exactly. Exercise is way better at reducing anxiety in both depressed and non-depressed youths.
But here's where it gets really interesting, because the researchers didn't just stop at the broad generic advice of, go get some exercise.
Right, which is usually not very helpful.
Exactly. That is where this data gets incredibly valuable. They broke physical activity down into 4 distinct categories to see what actually works best.
So they looked at aerobic exercise, which is your cardiovascular work, like running or cycling.
Yep.
Resistance exercise, which is lifting weights or body weight strength training. Mind-body exercise, like yoga or tai chi. And then mixed exercise, which is just a combination.
Now, I would have absolutely bet money on aerobic exercise or yoga. I mean, we constantly hear about the runner's high or, the calming effects of meditation and stretching.
It's what everyone assumes.
But the undisputed champion in this 15 to 24 age group was resistance exercise, heavy lifting, and it wasn't even a narrow victory, was it?
Not at all. It absolutely dominated the data. In the network meta-analysis, resistance exercise had a 94.9% probability of being the best intervention for treating depressed youth.
That's massive.
And for preventing depression in non-depressed youth, it had a 90.3% probability. I mean, it mathematically crushed running, cycling, and yoga.
Okay, this is the part we really need to dissect. Why does picking up a heavy barbell and putting it back down have a more profound effect on a severely depressed brain than going for a nice 3-mile run?
Well, what's fascinating here is we have to look at the physiological mechanisms first, specifically inflammation.
Okay, inflammation.
Yeah, there is a growing body of evidence that actually links clinical depression directly to systemic inflammation in the body.
Really?
Yeah, when your body's inflamed, it sends these chemical alarm signals, they're called cytokines, across the blood-brain barrier.
So the brain is essentially receiving a distress signal from the body.
Exactly. And the brain responds to those inflammatory signals by initiating what's called sickness behavior.
Sickness behavior, like when you have a cold.
Exactly like that. Think about how you feel when you have the flu. You're lethargic, you withdraw socially, your appetite changes, you just feel totally miserable.
Right.
Well, that sickness behavior mirrors the exact clinical symptoms of depression. And resistance training is incredibly unique here because it acts like a fire extinguisher for that systemic inflammation.
Oh, wow. So it's actively putting out the fire.
Yes, it actively downregulates pro-inflammatory markers in the body, like TNF-alpha, which literally stops those false alarm signals from reaching the brain.
That fundamentally changes how we view lifting weights. I mean, you aren't just tearing muscle fibers to look good. You are actively suppressing the chemical signals that trick your brain into feeling hopeless.
Exactly. And there's actually another biological mechanism mentioned in the study, which is brain-derived neurotrophic factor, or BDNF.
Right, I've heard of BDNF. It's like fertilizer for the brain.
That's a great way to put it. BDNF is a crucial protein for neuroplasticity. You see, depression has this way of entrenching the brain in these deep, rigid, negative neural pathways.
Kind of like a deeply rutted dirt road.
Yes, and it is incredibly hard to steer your thoughts out of those ruts once you're in them. But heavy resistance training triggers a massive release of BDNF.
Which physically helps your brain pave new, healthier neural pathways.
Exactly. It is quite literally helping the brain rebuild its own infrastructure.
That is incredible. So that handles the biology, but the psychological mechanism might actually be the most compelling part of this whole deep dive.
Oh, for sure. The study heavily cites Albert Bandura's social cognitive theory of self-efficacy.
And self-efficacy is basically just a psychological term for your internal belief that you are capable of succeeding at a task, right? Or overcoming a challenge.
Exactly. And depression just destroys self-efficacy. It makes you feel entirely powerless and completely incapable.
So how does lifting weights fix that compared to running?
The reason resistance training is so much more effective than aerobic training for youth mental health really comes down to the feedback loop.
Because the gains are undeniable. I mean, if you take up running, your cardiovascular endurance improves, sure, but that improvement is largely invisible.
Right, you might feel a little less winded running for the bus, but it's totally subjective.
Exactly. But resistance training is entirely objective. It provides immediate, highly visible data. Like last week, you struggled to lift 50 pounds. This week, you lifted 55 pounds.
It is proof, written in iron, that you are getting stronger and more capable.
And that objective physical proof directly, actively combats the psychological feelings of inadequacy.
Yes, by providing a measurable, undeniable record of physical improvement, resistance exercise produces a psychological triumph. It completely counteracts those negative emotions of depression. You are proving to yourself in real time that you have power.
Okay, so we have the ultimate intervention. The data is clear. But just like our amber bottle of pills from earlier, a prescription is pretty useless without a dosage.
Very true. Too little won't trigger the biological changes, and too much will lead to burnout.
Right. So the researchers ran a subgroup analysis to find the exact parameters that yielded the most effective interventions.
They isolated the ideal frequency, the duration, and the overall length of the program. And the optimal dose for treating and preventing depression is working out 3 to 4 times per week,
Okay, 3 to 4 times.
with each session lasting 30 to 60 minutes, maintained over a period of more than 6 weeks.
Okay, let's unpack this, because getting a severely depressed teenager out of bed is a monumental task on its own. Telling them they need to go to a noisy, intimidating gym and lift weights 4 times a week sounds like an impossible compliance hurdle.
It sounds daunting, yeah.
Does this specific dosage actually make sense for this demographic?
It does, and here's exactly why. Let's look at the duration first, that 30 to 60-minute window. Less than 30 minutes simply doesn't cross the biological threshold required to trigger a sufficient endorphin release.
Or that BDNF production we just talked about.
Right. The biochemical response is directly proportional to the stress placed on the body.
So a 15-minute quick workout at home might get your heart rate up, but it doesn't flip the neurochemical switches needed to treat the depression.
Correct. But if you push a session past 60 minutes, you hit a completely different wall, which is lifestyle attrition.
Oh, sure.
Workouts longer than an hour create massive scheduling conflicts for high school students and young adults. The perceived barrier to entry just becomes too high, and they quit.
So 30 to 60 minutes is that narrow window where biological efficacy meets real-world sustainability.
Exactly.
And what about the frequency? Why 3 to 4 times a week? I mean, why not just work out on the weekends?
Well, depressed individuals often struggle profoundly with a lack of structure and an overwhelming sense of disorganization. Working out 3 to 4 times a week forces a routine. It anchors the week.
That makes sense.
If you only do it once or twice, it just remains an anomaly and never becomes a habit. But on the flip side, if you're prescribed 5 or 6 days a week, you introduce systemic fatigue.
Right. You risk overuse injuries and central nervous system burnout.
And that actually increases physical stress and can worsen the depressive symptoms.
Wow. Which brings us to the final metric. The program must last more than 6 weeks. What physically happens at the 6-week mark that makes it the magic number?
6 weeks is the baseline timeline for actual physiological adaptation. Before 6 weeks, mostly what you're experiencing are just neurological adaptations.
Like your brain getting better at communicating with your muscles.
Exactly. But past 6 weeks, your body is actually structurally changing. You're increasing mitochondrial density, building new capillaries, and fundamentally altering your cardiovascular and stress response systems.
That's fascinating.
And furthermore, if this training is happening in a gym, 6 weeks is usually the minimum time required to start recognizing faces, exchanging nods, and building a peripheral social support network.
Which is a massive protective factor against depression in itself.
Absolutely.
Okay, so building physical strength builds mental resilience. But here is the elephant in the room. Handing a loaded barbell to a distracted, exhausted 16-year-old sounds like an orthopedist's absolute nightmare.
It does sound risky.
If you, the listener, are going to adopt this or encourage someone else to, we have to look at the danger. This is where we bring in the data from Evidence Strong. How dangerous is lifting heavy things, really?
Well, whenever you prescribe a physical intervention, you always have to weigh the orthopedic risk against the mental health reward. The Evidence Strong review aggregated 20 epidemiological studies covering a wide variety of strength sports. And the baseline risk across all of these disciplines is about 1 to 2 injuries per lifter per year.
Okay, and to put that in training terms, that is roughly 2 to 4 injuries per 1,000 hours of training, which sounds a bit abstract until you compare it to other sports.
It's remarkably low, actually.
Mm-hmm.
If you look at high-impact contact sports, like soccer, rugby, or American football, the injury rates per 1,000 hours are exponentially higher.
It makes logical sense, honestly. It is much safer to predictably lift a barbell in a highly controlled environment than it is to have another human being unpredictably tackle your knee on a muddy field.
Exactly. The variables in resistance training are almost entirely within your control. But the data does show that strength sports is a broad umbrella, and the risk changes wildly depending on how you choose to lift.
Oh, the spectrum of danger here is fascinating. On the safest end, you have bodybuilding. Bodybuilding is focused on hyper-controlled movements, isolating specific muscles, and using lighter weights for higher repetitions to build aesthetics. And bodybuilders experience a ridiculously low 0.12 to zero point 0.7 injuries per year,
And then on the other end of the spectrum, you have strongman training.
which just looks painful.
Strongman is the absolute peak of the risk matrix. This involves lifting awkward, non-standard implements, Atlas stones, slipping massive tires, carrying heavy yokes across a parking lot.
Yeah, strongman athletes experience about 2.0 injuries per year. To contextualize that, strongman training results in 1.9 times more injuries than standard powerlifting or weight training.
Right, because standard lifting relies on predictable barbell movements like squats and deadlifts.
So if a young person sticks to traditional resistance training or a bodybuilding style of controlled lifting, their physical risk is remarkably low.
Very low.
But injuries still happen. Are we talking about catastrophic muscle tears here or just nagging joint pain?
Well, the data splits injuries into acute and chronic. Acute injuries are sudden traumatic events, so a sprained wrist or a muscle strain. Chronic injuries are overuse issues like tendonitis in the elbow or the knee.
Okay. Yeah.
In most strength sports, acute injury rates were higher, ranging from 26% to 72% of all reported injuries, while chronic rates sat between 25% and 50%.
So to get these massive mental health benefits without suffering those physical setbacks, we need to know when and where these injuries actually occur.
Right, let's look at the anatomy of an injury.
There is an incredible timing paradox in the evidence-strong data. It shows that injuries tend to happen early during a normal training session, but they happen late during a competition. Why would the timing flip like that?
It's really the difference between a lack of preparation and total systemic exhaustion.
Interesting.
Early training injuries almost always point to skipped warm-ups. An athlete walks into the gym, they're in a rush, their core body temperature hasn't risen, their joints aren't lubricated with synovial fluid.
And they try to lift a heavy weight before their central nervous system is fully engaged.
Exactly. The tissue fails simply because it wasn't prepared.
Ego lifting. Rushing to the heavy plates before you've done the groundwork. And the late competition injuries.
Those are driven by systemic fatigue. At the end of a long powerlifting meet, an athlete is attempting a maximum effort lift. Their nervous system is just completely fried.
Right.
And because the brain can no longer effectively recruit the necessary motor units to maintain perfect form, their technique breaks down under maximum load, and that results in injury.
The data also highlights some really interesting demographic differences. Women overall have lower injury rates than men.
They do.
They suffer fewer acute injuries and fewer chest and thigh injuries. However, women do experience statistically higher rates of knee injuries compared to men.
And when you look at skill level, a really telling statistic emerges. Elite international lifters actually suffer fewer acute injuries than national level or amateur lifters.
Which just proves the absolute protective power of good technique. The better you get at the actual skill of lifting the weight, the safer the entire endeavor becomes. Efficiency protects the joints.
Speaking of joints, the most common injury locations across all strength sports are highly predictable. It's the shoulder, the lower back, the knee, the elbow, and the wrist or hand.
So, bringing this directly back to you, the listener, or the young person in your life you're trying to help. If you're going to use the squat rack as a treatment for anxiety and depression, you need to be strategic.
Definitely.
You can mitigate almost all of this risk by doing two very simple things. Never skip the warm-up to avoid those early session injuries, and actively focus your secondary, smaller exercises on protecting those vulnerable joints.
Right. Build the musculature around the lower back, the shoulders, and the knees.
By focusing on technique and targeted joint protection, you take an already low-risk activity and make it incredibly safe, allowing you to reap the profound mental health benefits without interruption. So let's synthesize all of this. What does this mean for you? Resistance training is not just a tool for building muscle mass, it is a highly potent, scientifically proven intervention for treating and preventing depression, particularly in young people navigating that chaotic transition into adulthood.
It works on a biological level by acting as a fire extinguisher for brain inflammation and releasing proteins that build new neural pathways.
And it works on a psychological level by providing undeniable, objective proof of your own capability, completely shattering the depressive illusion of powerlessness.
And while the physical act of lifting weights carries a baseline risk of injury, that risk is highly predictable, manageable, and largely preventable.
If you stick to the optimal dosage, 3 to 4 times a week, 30 to 60 minutes a session for more than 6 weeks, with a strict focus on form.
Exactly.
But before we wrap up, there is one final subtle detail buried in the Frontiers study that I think completely reframes this entire conversation.
Yeah, the researchers noted a really specific physiological quirk in depressed youths. They exhibit a heightened susceptibility to physical fatigue during exercise.
Meaning their baseline of exhaustion is elevated by the disease itself. The depression literally makes physical movement feel biologically harder for them than it does for a healthy person.
Yes, the disease actively tries to keep the body perfectly still, which raises a really profound question to leave you with.
Right.
If depression inherently weaponizes fatigue to stop you from moving, how much of the mental health benefit of resistance training comes simply from the psychological triumph of pushing through that initial disease-induced exhaustion?
Is the physical act of lifting the weight actually secondary to the mental act of conquering the fatigue? By forcing your body to move against heavy resistance when your brain is screaming at you to just stay in bed, you are actively proving to your own nervous system that the depression does not have absolute control.
It suggests that the real weight you are lifting isn't the iron on the bar. It is the depression itself. It turns a standard workout into an active physical rebellion against a disease that wants to paralyze you.
It completely changes the definition of what it means to be strong. The most effective prescription for mental health doesn't come in a little amber plastic bottle. It is made of iron, it is heavy, and it requires you to actively choose to pick it up. Thank you for joining us on this deep dive. We encourage you to keep asking questions, explore the source material for yourself, and most importantly, keep moving. Until next time.